This is Jesse recording Bobby doing insertion of Foley catheter.
First, I am going to review the medical record, the physician order, and the nurse notes. I am going to look for previous catheterizations, the size, the patient response, and type of catheter that was used. I am going to note if they have any allergies. I am going to note their age, a baseline weight, and their gender. Then I am going to perform hand hygiene, and then I will enter the room. I will introduce myself, I will identify the patient, and I will ask them if they have any allergies. Hi, my name is Bobby Fisk. I'll be your nurse today. Can I get you to tell me your name and date of birth? Allergic to penicillin. And I am going to compare that information with the medical record. I am going to ask the patient their knowledge of catheterizations, and I am going to note their feelings about it. I am going to I'm going to perform hand hygiene again. I am going to apply my gloves. I am going to palpate the bladder for fullness. I am going to, I would be able to use a bladder scanner if needed. And I would raise that side rail. Will you raise that for me real quick? Have my assistant raise the side rail for me. I would palpate the bladder for fullness. And then I will also note when I was looking through my chart, any pathological reasons that would prevent the insertion of the catheter. And then after palpating the bladder, or possibly using a bladder scanner if available, I will remove my gloves, perform hand hygiene. I will go and gather my equipment according to physician order for the size and type of catheter. I will bring it back to the bedside. I will re-perform hand hygiene. I will explain the procedure to the patient, and I will provide privacy by closing the curtain and the door. I will have arranged for assistants to help me with the catheterization, and I will ensure that the bed is at a proper height, head of the bed is down, and I will position and drape the patient. And as I'm positioning and draping the patient, I will ensure that they have a soaker pad under them, or I will, if not, I will place one. I will position the light to illuminate the genitalia so that I can note any anatomical landmarks. I will note for any erythema, drainage, odor, discharge, and I will note the placement and position of the urinary meatus. And if the light is not close enough, I will have my assistant help with the light. Then I will provide pericare by washing, drying, and rinsing the urinary meatus. And as I did that, that's when I would notify or notice all my landmarks. Then I would perform hand hygiene. I will open my kit. I am actually going to use this as my trash at the end of that. I will then arrange my sterile field, make sure it's at waist level. I will open my kit. So from here, I would gather all of my appropriate equipment that I needed for the right size and the right type of catheter. I'm going to arrange for help if I need to, and I'm going to explain the procedure to the patient that we're going to be inserting an indwelling catheter into their bladder today. So from here, I'm going to go ahead and I will perform hand hygiene. I'm going to make sure the patient is comfortable. I'm going to provide privacy for the patient. I am going to remove my sterile gloves. I am going to remove the fenestrated drape. I am going to have my assistant lift the blanket on the perineum. And then I'm going to go ahead and apply gloves. There is a pad already here, so I'm going to go ahead and put it underneath them. Will you also move this blanket over here, right here? And then I'm going to rate my patient and get them into the most comfortable position. And then I will place this underneath their buttocks as they lift up. I would not have taken my eyes off of my sterile field at all in this process. I will grab my white prints. I have two. I will dispose of these. I will then apply my sterile gloves. Ensuring that my paper does not cross over my sterile field, otherwise it will be contaminated. I am going to apply my first glove. I will apply my second glove. Then I will arrange my sterile field. I'm going to, I believe I just broke sterile by letting my arm cross right here within the ungloved part. I would discard my box and get a new set. I'm going to get rid of this. I am going to open my alcohol swabs. I am going to place them in my bucket. I am going to open my lubrication. And dispose of. I will then take the inner wrapper off of my catheter. As I coil it into my hand. I will lubricate the catheter 1 to 2 inches for a female, 5 to 7 inches for a male. At this time, I am also going to connect my sterile water syringe for inserting my balloon. Then I am going to place the catheter back inside the box. I will also ensure that my port is closed on the drainage tube. I will then move my sterile field to between the patient's legs. I will then cleanse the urinary meatus. I will separate the labia. I will clean one swab down. One swab this way. And one swab down. I would consider this contaminated because it fell out and touched my 1-inch border. At this time, I would get a different kit. I am going to pick up the catheter and insert it. Once urine appears, I will insert it 1 to 2 inches further, ensuring that I am not touching the urinary meatus with my fingers. I will then grasp the catheter. I will insert the 10 milliliters of sterile water into my balloon. And I would have let the bladder empty fully unless policy restricts it. and then once I insert the balloon, I would release the catheter. I would tug till resistance is felt and then insert slightly. Then I would remove my sterile gloves. Perform hand hygiene. Reapply gloves. And I will attach the catheter to the leg strap. Making sure that there is no tension or restrictions that would be putting tension on it. I will then connect my drainage bag to the bed frame. I would ensure that it does not touch the floor and that it is not hooked to any side rails, and double check to make sure my port is closed. I will coil my tubing and I will connect it to either the top sheet or the bottom sheet or the bed pad so that it doesn't get pulled when you reposition the patient. I will then provide hygiene as needed. I will dispose of my supplies. I will re-perform hand hygiene. I will reapply my gloves. I will assist the patient to a comfortable position. I will place the call light within reach and all personal items. I will then continue to first I would measure the initial output and record the amount of initial output from the catheter bag. Then I would continue to evaluate for bladder distension or fullness. I will continue to monitor the consistency, amount, and contents of the urine in the drainage bag. I will keep assessing their comfort level, and I will ensure that there are no leaks of urine in any of the tubing or the drainage system. And then I will do my documentation.